Hey everybody, it's Karen Anderson back again with Aortic Hope for tonight's final Q&A of Aortic Disease Awareness Month. I am so excited to have Amy Wagner with us. She's an LCSW-C and she will explain to you what all those letters mean. And we've kind of wrapped up this month as we normally do. We go through all the education of what's an aorta, talk all about the different disease elements, valves and dissections and aneurysms, etc., and genetics and medication. And we talked about it all. And then we save what I think is probably the most underrated topics, which is mental health and emotional well-being when it comes to disease and anything that's emergent that would be, we talked today about health trauma, so we did talk about that. So that's what we're talking about tonight, you guys. I'm going to let Amy introduce herself, and just remember to click like, click subscribe, and click that button with the little bell so that you're notified every time we go live. And now you can take it away, Amy, and I'll be quiet.
Okay, thank you for having me back again.
You're welcome.
I always enjoy my time here. My name is Amy Wagner, and I am a LCSW, and that's a licensed clinical social worker certified, and that allows me to do private counseling, psychotherapy, that type of thing. And I know that with any kind of medical conditions, chronic conditions, even emergency surgeries like with aortic surgeries, anything like that, it really can affect your mental health. And I think, like Karen said, that is one area that kind of gets put on the back burner sometimes because your medical health is so important and takes the priority. But then I think when everything starts to settle down, that's when the mental toll that it has taken on you comes out. And many times we see the anxiety growing or more depression happening. And those are all very normal reactions to having a medical emergency. But I guess the next step is, what do you do about that? And how do you seek help and get help to address that? So hopefully we can answer that tonight. And
well, there's so many elements to it. You know, I heard a surgeon not too long ago say that he thinks that when it comes to a dissection, at least the biggest emergency that you can have, that it probably starts in the ER, because most of the regional centers might get 1 or 2 dissection patients a year. So when they see it and they have 100% diagnosed it, they kind of like freak out. So they can't hide their emotion because they know time is just so critical. And when a physician is looking at you and like, okay, you've had something called an aortic dissection, we have to life flight you or you're going to die. Well, okay, that's trauma number one.
Trauma number one.
I have gas. I got reflux. I tore a muscle. I'm too young. I'm healthy. There's so many different things. And I feel like if we started there, we could teach these physicians a better way of delivering the information.
That's true. That's true. I'm not sure the amount of education and training they get in their medical school classes about trauma. I mean, because their main focus is to save a life. But I really think that if they're not getting enough of that, that a 1 or 2 trauma courses in all the rest of it would be very helpful.
Yeah, how to communicate life-threatening trauma, emergency or something, or what the repercussions are if you don't deliver it in an effective way. And then you get hit with, and we're just talking about an emergency surgery, because then you're hit with what this surgery is going to entail, or from A to E, the saying goodbye to family, the wrapping up your life real quick. Here's my will, here's my passports. And I would venture to say that adds a lot to the trauma, even though we're moving so quickly to get things done.
Right.
I feel like, in a way, from the minute you feel the onset of the pain and you know something's wrong, and then you're delivered the bad news, and you only have moments to get your whole life together before you're now like, they're taking your clothes off and you can't go to the bathroom. You have to use bedpans and all these horrible things are happening. And and then they want to bring you as soon as possible into the surgical room, it's like your brain just goes into it's shock. It
Mhm.
must be
It's
you, 'cause
shock.
the brain just says, we're done
Yeah,
here. We're just
and
going to be
that's a
done for a while.
shutdown mood, right.
Right.
Mhm.
So what is the difference between shock and disassociation?
Well, shock is your brain's immediate response to an event that is occurring,
Okay.
a traumatic event. And then dissociation is a response that occurs after, like
Okay.
it's almost like a coping mechanism to handle what has happened to you. You have to find a way to separate from it, or
Right.
it just continues to affect you.
Right. Okay. And so then you wake up from this surgery, and it's funny because it's not funny. I heard somebody once say to me, you know, I was on I was on the breathing machine for so long, so much extra, and they had to restart my heart and do CPR. And I mean, I could have died. Isn't that terrible? And all I can think of is, okay, but you didn't. You weren't even aware it happened. Why are we dwelling on this? Couldn't figure out how to help this person, because if I just listen, my only option is to say, yeah, you're right. But then that just feeds into it. And there was
Right.
nothing, there was no there. So I think that when you come out of it and you realize the gravity of what happened, and then we read our medical records that says, Karen Anderson's heart turned off at, and then paddles turned it back on, or shocked her at
Oh,
this. You just sit
goodness.
there for a while, you're like, let me read the name again. Is that me? And it's another bam, and it's
That's
again
right.
jarring.
Yes. Yes. And it's a lot to take in all at
Yeah,
once. I
yeah,
mean, it's hard for many of us, just the whole concept of death and dying.
right.
But then when you're faced with it right at that moment, and uh, like in your situation, you didn't have time to get together any papers and passports. And no, it was okay, we've
We're out.
got the helicopter coming now and
Yeah,
you're
that's
going.
it. That's
So
pretty much it.
I think the one thing we can all learn from our situations is not to put off, you know,
Right.
writing that
What is
last
it?
will and
What's
testament,
that?
or
What's that saying? Don't put off.
today, tomorrow. Don't put off tomorrow what you can do
Right.
today,
Exactly.
because
Exactly.
tomorrow may not come.
That's
And
true.
so I think if anybody still, after going through these life-threatening experiences, is still does not have a will written or an advance directive, or things of that nature, your affairs in order, it's a lesson we all can learn from, is
Right.
don't wait until it's too late.
Yeah.
um,
Exactly.
and have all those, if you want to write a last letter to somebody just in case, because none of us know. But I think this really brings us to that, where we're looking at it right in its eyes, and
Right.
so it leaves
Yeah.
that forever mark on you.
So we then come out of surgery. And so now we've got the gravity of this, and what does recovery look like, and feeling this new body, this encasement, and nothing feels familiar. And I think for a lot of us, it takes a long time before we recognize any signs or symptoms that there could be something a little different, because you're told, well, the blues are normal, and they are. I've had many surgeries, many, and being a little depressed after anesthesia, that's normal. And you cry a little bit more, and you look at a kitten and you cry, and you watch a Hallmark movie and you cry, and all of that's very normal. But I think with this, the gravity of it and the type of depression and overwhelming emotions. I think you described it to me once. Oh, just so those of you that don't know, Amy's my therapist. So a lot of what we talk about is like you said to me, and we did that. And there's no shame in my game. I mean, I'm very straightforward. I really am. I talk a lot about my own therapy, but I think or you or someone had once said that the tears is the way that the brain is healing itself. I think I heard. So your
Yeah.
body's healing, and you can't do both at once. It's like you can't like really truly appreciate a headache if you just rammed your foot, right? Because your foot now makes you know you're not even thinking about the head. It's the foot that hurts. So there's no way to like have all of this body ache and reassessing going on, and also deal with what you're not even aware is going up in your mind. So, but we just cry. There's a lot of crying sometimes. And I think that that is part of the brain starting to, well, now I'm starting to refire and there's something big happened here. It's
But
very
it's that
scary.
emotional release that your
Yeah.
body needs. And it does that many times through the crying process, and
Right.
just, you've got to get that out somehow.
We
Very
once
true.
talked about all of this being very similar to grieving. I mean, we just talked about it recently, I think. And during grieving, you can just associate all you want, but one of these days that crying's going to hit you. And you told me this about my dad, and you're like, and if you're in public and it hits you and we haven't dealt with it, oh boy, tell the people to watch out because you're
It's
just
going
going
to
to start
trigger it.
crying.
Right.
It's just going to happen. And I look at these emergency situations, at least definitely for me, and I'm sure other people can relate. There was a grieving process because you are grieving who you were because you're not that, at least not for a period of time, and you're not sure of anything, and you are like, nah, that didn't really happen. Then you're negotiating, well, maybe I don't have to take this many pills. Maybe I can push myself. No, I really can. And then you're angry and you're pissed off and you're looking for the why. And it's and then the crying, it comes at, it feels like grief.
It
It's
is
really
grief.
weird.
It's the before and the after,
Hmm.
and all of the realization of trying to get some normal life that you had prior, but realizing that pretty much life is going to be different from in many ways, than it ever was.
Hmm.
And um, just trying to come to terms with leaving that previous life behind and looking
Yeah.
at your new reality now.
Right.
And
Right.
that takes time. And I think you have to give yourself that grace period to work through that.
Yeah.
And that could be a year
Yes,
after
it
it,
can.
or I mean,
Yeah.
it's not going to be an overnight type of thing.
Right. And when it's emergency, it's hard to give grace because you don't know that it's happening.
Right.
But if we flip the script a little bit and we talk about people who are in this watch and wait category, so they know they're going to have surgery, it's planned, or they're just watching and they don't know when the day is going to come. It might not ever come, but it probably will come. But who knows when it's going to come? And they're still going to want to plan a surgery. I think that's different. I think that you then, you do have time. You have time to try to prepare yourself
Oh
for a
yeah.
big surgery, prepare your
Yeah.
life,
Yeah.
think some things through. I mean, we've
Yeah.
discussed my PTSD that I've had and lingering issues. And so it's like, how do you prepare yourself if you don't even know you have that? And we'll get back to what that looks like in a minute. I took a note of a PTSD symptoms. Um, what's the best way to prepare for, what could, but probably won't be, but could be a life altering surgery? It's a big surgery. They may do it all the time, right? And these doctors are like, yeah, I'm going to do a dime a dozen, but it's still big for us. There's
Yeah.
it's a lot that's going
Absolutely.
on. We're not going to feel great for a while. How can people kind of prepare themselves mentally for something it's in the unknown?
And that's the thing, is when it's unknown, it can create a lot of anxiety, just the waiting or anticipating it could happen at any moment. But I think you prepare as much as you can with, I think,
Mhm.
like I was saying before, having your affairs in order, so to
Mhm.
speak, all the
Mhm.
paperwork or all those things in order. But I think educating yourself, getting more involved, like with groups like this, so you can get as much
Right.
information and learn from other people's experiences. Um, really communicate with your doctors to
Right.
really understand what are the steps that are going to happen if it becomes an emergency, and plan ahead. If you're someone who's still working, what
True.
would your job, how would they handle that? What's the
Mhm.
procedure for leave time, and getting all of those things,
Yeah.
because you have the benefit of a little bit more time versus
Right.
an emergency.
Right. Okay, so we have the surgery. One way or
Yeah.
another, you have a surgery because I believe that people in watch and wait are being impacted emotionally, probably
Oh,
just as bad as those of us.
yes.
Because if you think if I don't mean to equate it to a death. I really truly don't, everybody, because that's just horrible. But if we're talking that they both can kind of mimic grief, we did discuss this. It's kind of like when my dad died suddenly, that was horrible, but you can't compare it to people who are sick. Because when somebody goes immediately, it's really bad for us, but might be better for them. And if they're sick and it lingers, it's really bad for them, but might be better for us. So when you have something emergent, because there's an emergency, it's really better in a way. How do you determine, is it better or is it worse? Then because then waiting
Right.
and you're just sitting and you're waiting.
Because
I
you have
can't believe.
time to keep thinking,
Yes.
and
Right,
that
right.
sort of thing.
So they're
And
both impacting you similarly, and yet it's
absolutely.
horrible. It's all just horrible everywhere around. I'm sorry, it's horrible. I'm gonna have a pity party for myself
But
right
we
now.
got to have some hope here. You can get through this, you know?
Yeah,
You can
I
and you
mean,
do get through it.
I know,
Yeah,
but
do you worry that, it could happen, something else could happen or another health issue or
right.
whatever, but
Well,
it's,
what
I
ifs
think,
are the worst, right? What ifs are
yeah,
like the biggest
ooh,
enemy on the planet
they're
because you can't do
terrible.
anything about any of them. And as soon as you feel them coming on, it's not even worth your time to what if it. But I will tell you that when people say, "Oh, it's going to be great, it's going to be fine, you're going to be uncomfortable. But, every surgery is uncomfortable, but it's going to be fine. Everything's fine. Okay, that does not make me feel better. That makes me irritable, because what I really want to hear is someone say, and I've started saying this to people, "Oh, that kind of really sucks. Yeah, that chest tube, that's not going to be fun." But it's only not going to be fun for a second, but damn, that's not going to be fun. I want the honest. I want somebody to be
Right,
like, "Yeah, that's just me. I would rather someone say, "Yeah, that breathing tube, that just really that's no play." But once it's out, then it's fine. And
right.
yeah, this tube, ooh, that's where they took that out. That was no, but then you were fine because that's something
You're
I
going
would,
to get through this. You're going to
right.
get
I'll
through
get
it.
through it, but it's going to
Yes.
be
Yeah.
not necessarily
It's
pleasant.
not pleasant. It's not
Not
pleasant,
pleasant.
but
Yeah,
you
that's
know,
easier for me to take that because some people say that's pessimistic. I'm like, no, I would rather think of the worst and then it doesn't happen. So I'm overly elated than to think it's not going to happen. And then when it does, I'm freaking out.
right, right.
I don't know what that personality type makes me. I don't know, but it makes me whatever it makes me.
Yeah,
You
I mean,
should
I
know.
think there's two types of categories. People
Yeah,
that have the need to know every detail and not be surprised,
right,
and then those who are the avoider category.
right,
The less I know, then I don't have to worry about it or think about it or consider it. So I'll just wait
right,
it out,
right.
and deal
Yeah.
with it and
Ooh,
so you have to figure out which one are you,
yeah.
and do you need to modify that a little bit? But
No, I've actually advocating for myself so much that I told the surgeon that the moment they have the first IV in, it would be really better for everybody if they gave me a drug right away because I
okay,
don't, well, and it's for a few reasons.
yeah,
I don't want to have to do the whole make small talk with the family as they're waiting. I don't want to do the say goodbye. Like I don't. If it's going to be okay, then why are we saying goodbye? Because for you it's a long time. For me, it's a blink. I don't
right.
want to. I just want to be out of it. And because I don't want to be awake when they wheel me into the operating room because I think I will be so incredibly scared that they're going to be like, this chick's blood pressure needs to come down before I touch her. Any other surgery, I'm fine, but this is just something about this because it's
I think that's a good
reminiscent.
point you make, is that as much as you can be involved in your treatment
Yes.
plan,
Yeah. Yeah.
and advocate for yourself with the doctors, the surgeons, and all that. This is what would make my experience better.
Right.
Yeah,
Some spa music, a little bit of lavender. And if you want to rub my
right.
feet while I'm going out, that works. Oh,
That's right.
God.
That's right.
All right.
And so, um, and don't be afraid to say to your doctors,
Yeah.
this scares me to death, or I'm
Right.
a nervous wreck, or and that kind of thing, and really let them know, because
Yeah.
they're just very tunnel vision about, they've got to get this procedure done correctly, they've got to
Mm-hmm.
do that, and
Yeah.
So you
I
got
know.
to let them know what you're going to need too and be a part of that.
Right. So you come out of all of this and
Yep.
okay, so how does somebody even begin to recognize that this is more than just I'm crying a little over a kitten? Like what symptoms would someone traditionally be feeling that should make them say, I think I need to have, we're all told about postpartum. Well, women now know when you get pregnant, now it's talked about postpartum syndrome. Like this was never talked about, we didn't really talk about this, but now people know. So what would be some of the things someone should look out for that might give them a clue like, we might be dealing with something that's a little bit bigger than just I'm coming out of a big surgery?
Well, anytime we look at if something is going into the more PTSD, the
Mm-hmm.
post-traumatic stress disorder, we look at anything really 30 days after an event.
Okay.
Um, just to give your brain its own time to kind of process all that's happened on its own.
Mm-hmm.
So I look at anything that is still occurring about a month out.
Okay.
Are you still having difficulty getting out of the bed in the morning and getting moving?
Mm-hmm.
Are you not engaged in your aftercare? Are you having crying spells most of the time? Are you sleeping too much? Are
Mm-hmm.
you not eating enough?
Yeah.
Are you having like these panic attacks or overwhelming fears, fearful of going even to walk outside?
Mm-hmm.
So things that after about, I would say 2 weeks, if you're not making some movement towards getting back into some semblance of your life, and then up to that month period of time, then I would say you need to really maybe consider seeking some outside help
Mm-hmm.
uh, to work you through that. That's more of an indicator that the trauma is greater than what your brain can work through on its own.
Because sometimes we can be foggy brained and we could maybe not have great memories. And a lot of that stuff is sometimes just, we're always told medication, medication, medication. But I think people wait way too long. I think that there's more than just me who waited almost close to a year before I started really delving into it this with you. I mean, I was
Mhm.
doing talky talk therapy. Is that CBT, right?
Yeah.
Reframing, a lot of reframing. Yeah, no, the reframing was not really working because there was nothing in me that could see anything to be positive. Being alive, no, because it was so much overwhelming messaging in my brain. I think I even told you once that I felt like I was a ghost. I was outside of myself and watching my life happen. Now, when you add that to smelling alcohol all the time, no matter where I was, hearing machines, heart machines, monitor machines beeping,
Beeping,
real,
yes.
just real, like it's there. I remember my father was in the hospital for something, and I'm like, can they turn the machine off? And he's like, what machine? And I look at the machine, and it is not on. And but I heard it clear as day. Um, Nightmares about drowning, a lot of drowning nightmares. There was just sensory overloads. Helicopter. I'm putting the car in park, driving in the middle of a busy road and hiding. I wasn't even in a helicopter. I was taken by ambulance on the ground.
And mhm.
My brain just rewired what I should be fearful of, and why would I be fearful? Um, so much so that it became debilitating. Like I would become so overwhelmed that I didn't know how to get home from a food store. And I've lived here 17 years. You know what I mean? Like it was just crazy.
Yes, yes.
So it was finally, I heard somebody in the community talk about PTSD like this, and I thought, no, that's what people have that go to war. Like, I don't have PTSD. I never went to a war. Like, I didn't understand. And that's a big misconception. So maybe you can talk a little bit about too what PTSD is and what CBT therapy is before we get into the EMDR.
Okay, okay. Well, yeah, I think a lot of people have that misconception that post-traumatic stress disorder was more combat related, that type of
Yes.
thing. But
Yeah.
the field of trauma work has really progressed over the last several decades to really understand that any event that holds a level of intensity plus catches us by surprise or is more than our brain can take in at that moment, that can set up the whole scenario for trauma to take place.
Okay.
And that can be just, you know, being out, say your dog runs out of the house and you lose your dog and you can't find them and you look frantically for them, that can be turn into trauma.
Yeah.
Being in a car accident or just anything like that can become traumatic.
Right.
So I think that you give your brain a little time to work itself through. But unfortunately, like we mentioned, shock is kind of like the catalyst that can cause the trauma to stay stuck for us, because shock sets in to protect us, but it also shuts everything down and kind of like cements that event in our brain. And many times we can't get it unplugged to process it through. But for the moment, it helps protect us. But on the long term, it can keep us stuck. And so I think that's where the whole realm of PTSD has come through. And the regular talk therapy, we used to be able to try to help people get through trauma with talking it out, re-looking at it, rethinking about it in different angles and ways. But we realized that people were still experiencing symptoms like flashbacks and things like that, that they just could not get through them. And it was creating a lot of disturbance. Also, knowing that trauma, if you had anything prior to that that was unresolved, having an event like, you know, a dissection could bring out all that other trauma from your past too. So you've accumulated trauma and what we call complex PTSD. So that's how, out of that, really doing research and study, they've come up with other techniques to try to help unplug and process. So
and we're going to get into that. We're going to get into that. Before we do, I want to ask Josh what's going on in chat.
Well, we've got a pretty good back and forth going here with Molly and you guys.
Okay.
Let's say hi to Terry and Molly and please and thank you.
Hi.
Hello.
When we were going over getting your affairs in order, Molly shares, ironically, I was putting my will and other importance together, knowing I was going to have aneurysm repair surgery in a month. That very morning, I dissected, thus emergency surgery.
Oh,
4.5 years later, I have yet to get that folder together. It doesn't bring on the warm and fuzzies.
It's hard. It's hard. But and maybe really kind of doing a self-examination of what are you avoiding or what are you holding off from doing that. And I think any of us, whether we've had a medical emergency or not, it's not a comfortable thing to have to, you know, sit down and try to plan out, okay, when I pass away, you know, who's going to get this or who's going to take care of my estate or my affairs or whatever. But I think it's just part of the whole life process that we just have to include that in part of our life journey. It's part of it and preparing for that. So
it's tough. I'm actually doing it myself, and I didn't have it done, so I tried to get it all wrapped up as much as it could. Not that there was a lot to write down, but you know, you don't want to do it in an emergency, driving in an ambulance, and the transport nurse is looking at you, and you're getting emotional. That's not an effective time. So I'm actually going to be doing it myself with an attorney that I'm going to be interviewing here to explain to everybody what's involved in the process and how we can do it in the most cost efficient way, and why these things are important. You know, that's the key, is if you understand the why. But I think in Molly's case, there's a tie-in that still hasn't been, untied, which
Right.
is, I was doing this then, so maybe I'm just not going to do it. Like, I think I've never done it. And I used to think I never did it and I was okay, but now I wasn't okay. So I might as well do it because it's not going to happen again. So I'm already having surgery, and I already had something bad happen and I hadn't done it. So that clearly was purely superstition. All right, Josh, go ahead.
Yeah, she says, almost as if I jinxed myself.
Oh,
Yeah.
When we
you'll get
rounded it
it.
into the post traumatic stress, Molly raises her hand. Yes, the
Okay.
PTS was there for 2 years, anticipating
Mm,
explosions, airplanes coming through the living room window, getting stabbed in the middle of the night, etc.
Yep.
oh,
Right.
Finally
wow.
sought help. Now just loud noises, crowded spaces, and sudden movements get my attention.
Yeah, crowded spaces definitely. Oh, and it's not for any, like you would think a lot of people these days get nervous because of various types of shootings or terrorist attacks and stuff. And I think
Right,
that stuff
right,
sometimes, but I think it's just with my PTSD, it's just too many people. I think there might have been a lot of people, I guess, in my room when I got to, the big hospital. And so even now, all of my trips to the ER, I have to say I need one voice because you're all asking me. I will not be able to answer anybody because my brain will just, if there's too much coming at me, my brain just shuts down. And it's been years
right,
later, and I'm okay. I know about it. It's probably not going to get better. So I just tell everybody, this is, if you want me to answer something, the one person, and they did. They made the
right,
change right away. So some things I think may just never change, and you just learn to adapt. Can't change everything and make it all perfect. It might not always go back.
right.
So at least I can work with it. But I want us to get into the PTSD and the EMDR because
Okay.
you said something um, very interesting about how it can potentially bring up stuff from your past. So when I went to see Amy, I mentioned all the things I've already told you that I was experiencing, all those triggers. And it wasn't like the first time. You didn't do it to me the first time, but a couple sessions in, like you just randomly like just opened a pack of alcohol swabs. Oh my God, I was so upset. Oh, I got so upset about that. It just was like nauseating and irritating and anger and all these feelings. And it was just like you can't breathe and you just don't know why. It's just so silly. I'm in this beautiful office with these birds eating in a bird feeder out your window, and I'm smelling
Right.
alcohol. And it's like I feel like
I did a
I'm
little
gonna die.
exposure therapy
Oh, don't do
there.
it. Don't do that with spiders. Everybody in this community knows how and I don't. I get enough of
Well,
that
don't
every
worry about
season.
that.
Yeah,
But yeah, a little bit of
yeah.
exposure therapy there.
So it's
Um,
funny. We were talking about the dissection because you start off these processes where we have to fact find, right? You as the therapist needs to gather information about where I think my problem is, and I
right,
say that with my air quotes because I don't know if it's just me, but that really wasn't my problem. My problem really wasn't the dissection. And I'm still fascinated by it because
mhm,
by the time we were done, and let's talk about what we did, because I sat there like this most of the time, like, is she looking at me? My eyes are supposed to be look. So explain the EMDR, what it means, and then we're going to talk about how we did it because it's just wild to me. I'm such a fan, such a fan,
I'm so happy about
such a fan. Oh
that.
my gosh,
Well,
yeah.
EMDR, which stands for eye movement desensitization and reprocessing, is a technique that was discovered or created back in the, I'm going to say, the late 90s. And it was being practiced on Vietnam veterans.
Mm.
So it did start off with that type of trauma, but it has led into being able to use it for any kind of trauma whatsoever. And what it does is it has you focus on a traumatic memory, any part of it you can start with. It will all lead back to where the problem area is.
Mm-hmm.
So you begin to focus on a traumatic memory using a way to get your brain to go from one side of your brain to the other. You can do that using your finger back and forth. We use little hand pulsers. It can be audio, little beeps, but anything that helps move that along. And what it's doing is it's mimicking what happens naturally with rapid eye movement sleep when you're asleep, your REM sleep. But that's usually where your brain works through all the material it took in that day to process it into your memory banks. But a trauma gets stuck. So this technique helps you unplug it out of the stuck place in your mind and process it along while you're awake. So you can see how it is, experience that, and understand the negative belief you were having about yourself from that trauma, and replacing it with something positive for yourself, and coming up with new ways to handle it in the future, which we call a future template. So there's all kinds of ways to help push that traumatic event into a more manageable place in your mind. So you're not triggered and having the flashbacks and all of those things that occur with a trauma.
It doesn't work after one, because during one, you're still sitting there with your eyes closed, like, is this person looking at me? Is she looking at me? Is she looking at me? Like, it's so weird. And it's I really looked at it, because you explained this to me as well, as when you're in REM, your brain is downloading like a computer. It's doing an update. It's updating and downloading info and doing all these things during REM stage. So when your eyes are doing this, it's doing its this is what we took in today. Saw a car accident, no big deal, nothing different about that car accident than the last one.
Filing.
Yeah, right. Filing, putting that car accident, putting that in, ate a burger, putting that in, what, right? But then you have this emergency event and the brain's like,
it's like,
wham. I don't have a file folder for that.
Right.
I'm just going to go, I'm like exploding. So I'm just going to stick it in scared, angry. I'm just going to shove it in all these other places. And so when you smell things or hear things or taste things, or you think you see things, you get all these emotional, crazy reactions. You may or may not have it tied into something in your past that has just been buried that you're not even aware of. So it's now going where the other stuff was. And it's like, wait, that seems familiar. We're going to react. We're going to make you react like this. So when you do EMDR, and it's not hypnotherapy, you just sit there and you think, you start at a place and you think quietly to yourself, holding these things that go bzz, bzz, and so your eyes automatically start, but you're awake. So it's really weird, because you start to move your eyes really fast. You're like, nope, let's just focus and think and move my eyes, because I can't help it, because something's touching me and now it's touching me here. And so you have an opportunity to think about this, performing a REM-like state with your eyes. So now the brain's starting to do what thinks it's supposed to do, but you're not in that scary place. So now it's saying, oh, we're remembering something. This isn't scary, because I'm sitting here with birds eating out of a bird feeder, and I'm fully dressed and I'm not hooked up to anything. And so when I think about it, I'm not in it. It isn't really scary. I don't smell any alcohol sitting in here. I don't hear any beeping. Oh, we're going to put you in obscure, bizarre surgery. We just had a medical procedure. And it's just like, it puts it someplace. It takes a couple sessions to do it. But when you mentioned, but when you mentioned before, it could be related, we started talking about, well, I've had many different health issues. And so you were like, what was the earliest memory you have? And the first one I had was, I was like, I don't know, 11 or 12. I remember, I thought it was the first memory of stitches and the needle hurt. Okay, first let's remember needle hurt. But then I remembered my tonsils. 11, she missed the vein and hit a nerve, needle hurt. You're not in control of any of this. You're like the child. You can't do anything. And then I remembered, like, I was 4 or 5 running, and my mother said, stop running. And I slid on the parquet floors in my socks, eyeball first, right into the corner of a slate table. And I remember that needle so vividly to this day, of Novocaine, not Novocaine, lidocaine, whatever cane, whatever numbing medicine, for them to just hit the rest of the needles. My father pulled up to the pediatrician's office, could hear me screaming from outside. It was very painful. And so when then you start thinking, well, this all really had to do with control and pain. It's like a health related, it truly is health related to my inability to control the situation I'm in. And when
That's
you're
it.
4 or 6, you're not controlling anything. You're
Right.
held down. I was held down so they could give me that needle, right? Otherwise, who knows where that medicine would have gone. And when you realize that, now there's a whole other perspective of things to think about.
That's right.
And then the talking therapy became so useful because I didn't realize how much control I actually had the day I had the dissection. And I don't think many people realize it at all. If you
That's
flip the
right.
script just right and squint, you can see that it says, I chose to make all those phone calls, to put my life in order, and to allow those doctors to do whatever they needed to do to me. I signed off and said, you can do that.
That's
I
right.
told them, okay, I'm ready now. I've now said goodbye to everybody. I'm now ready. And I never, it's like still, I'm fascinated by that. You just had to flip it a little bit and be like, let me look at it at this angle. Well, this is an accurate angle. And it changes everything. Just it changed that once I agreed to go and stop making up excuses why I couldn't go. And I did the work 6 weeks later, I felt like I was a changed human being. I was truly changed. It's amazing.
Did very well. You did.
It was hard. My head hurt. I
With a
was
lot.
scared.
Yeah.
It's a lot. It was a lot I'm like, the brain is a massively amazing, wonderful thing. But 6 weeks later, I didn't hear beeping anymore, and I wasn't smelling things. And if I did see a helicopter, I just, I knew to ground. We talked about 5 senses, which we talked about earlier today.
You're
I
grounding.
knew,
Yeah.
yeah, I had something to look at. I turned the radio on, put the air on so I could feel it. I had a smelly so I could smell it. If I had gum, I'd pop it. I just, just quickly anything. And by the time I got all my senses done, I didn't even remember what I was freaked out about. Just too worried about trying to find the fifth sense. Where's my gum? And then I'm going to think about why I was upset.
It's amazing. It's amazing technique. And I mean, I think it's important to point out that as much as your family may want to help you through it and all, they're going through their own
Yes.
piece of this too. So
Yeah.
I think sometimes being able to talk to someone who's totally separate from the whole situation and
Yeah.
can look at it objectively really can help you work it through as well. And
Right.
because there's no emotional investment in it for
Mm-hmm.
us other than just helping you work through this. But with your family members, they're still working through that they almost lost you and it was
Mm-hmm.
trauma for them and things of that nature too. So I think having that outside objective point of view really can be very beneficial, and I highly recommend it for
Well, and
anyone for that.
I've used it for things other than the dissection and medical. I've used it for other things, traumatic events that have
Right.
happened in my life, and it had a very similar impact to me. It just put things in the right perspective in my brain. And I was scared to change a perspective because I thought I would lose memories, but these were not my memories to lose. And
Right.
I learned that the memories that I have of certain situations is enough, and it's good and it's okay. And the brain doesn't always have to remember. I think some of the things that bother people in this community is they have a limited memory. Sometimes they don't remember. They may have been in the hospital a month and they don't remember, and they want so badly to remember. And
Okay.
it's you getting to this place where you realize what you remember it's enough. That's what the brain wants you to remember. That
That's right.
there's no reason to have to know everything. And
Know
why is
everything.
that?
It's just like with any experience, there's pieces of it that are just the fringe,
Hmm.
and it's not that those don't make up the whole
Right.
situation. So
Yeah.
they have less of importance than
Hmm.
like the heart of the matter.
Yeah.
So your brain just quickly processes those and files them. So
Right.
it's like with any situation, we don't remember all the details of everything.
Hmm.
It kind of hits the highlights, but
Right.
it keeps what's important, I guess.
And I think that You know, I've listened to so many different stories from people, and even when you hear people talk about a lack of trust because they were misdiagnosed or they weren't listened to, and I'm not a therapist, I'm not a therapist, and I'm not a doctor, but I'll listen and I'll think, I don't know that it's just that simple. I don't know if this is the first time you've maybe experienced a lack of trust or somebody that's significantly not listened and it's caused something. And I don't say anything because, again, I don't know what I'm talking
Right.
about, but I do
Usually
sit and
there's
I
a
wonder.
connection somewhere.
Yeah,
Yeah.
like if
Mhm.
maybe you knew where the further back in your past or maybe more recent, where this reaction to something like this happening, where it started, if you could fix that, the trickle down, the domino effect just is like a spontaneous. It's amazing. Like if I fix
Right.
that first thing that caused all of this reaction, you start to realize, like, I came away realizing, God, I've had so many health issues. And all I needed to do was fix the one, the earliest one. And now, like, none of them matter to me. None of them, except the
Right.
one that's coming. And I'm going to have to see you to talk about it because it is.
Right. It's coming up.
It's
Yes,
coming up. All right,
it
let me
is.
check in with Josh and let's see what other people might have to say.
Oh, we're all caught up on chat.
Okay,
Yep.
wonderful. The other
Okay.
thing you said that I think is important is is realizing that life can very well be better after health related trauma, change in life trauma, um, death trauma. I mean, divorce. It can be anything. Is that life it really can be better after any of these immediately impactful, emotionally charged. It's I think it definitely can be better
It
for
can be
sure.
better. And I
Yeah.
think it corrects our eyesight, I think a lot of times is to what is more the most important things in life. I think we
Hmm.
get all of us can get too caught up in the small stuff.
Yeah.
And things like this really help us learn to appreciate the more important things in life, which is valuing our relationships and
Hmm.
one another and the importance of living life to the fullest
Hmm.
and um, not to get caught up in frivolous things and that can be a positive that comes out of a difficult situation. So try
Hmm.
to find that silver lining somewhere. But
And sometimes you just need to take a minute and ground yourself. Let's talk about what grounding looks like. It was the other thing we talked about today on my previous show. Um,
okay,
let's talk about, because anybody can do this. You don't have to be part of this community to just, sometimes you do need to, I mean, this is all stuff that was like Mr. Miyagi, foofy, weird, metaphysical stuff. But then you do it, you're like, okay, there's something so to this. You can find a way to just ground or center yourself. Anybody. You
yeah,
can really take that moment is might all it might be all that you need to just look at life differently. Because my life, nobody will believe this, is so much better for it, for having had all the adversity I've gone through and all the pain, because that to me is just normal. I don't know what life's like that to not be in discomfort. It's actually variations of discomfort, whether it's like that might like low end might be my normal. For somebody else would be like, that's terrible. So my life is better for it. To the people that I've met and the things I've seen and oh my gosh, I would never had any of this. And to me, it's like, this is great. Yeah, helping people, like you're helping people. So who wouldn't find this to be wonderful? So
well,
how
and I
can
think
anybody,
out of your experience
yeah,
came aortic hope
like
to
crazy, right?
help other people. And so I see that as such a
Yeah,
humongous
yeah.
positive out of this. But
So how can other people ground themselves and also get that same wonderful feeling by just taking a
and
minute?
well, grounding usually grounding techniques are used because you're feeling overwhelmed,
Yeah.
having even a panic attack or just an anxiety episode, and just feeling like you can't grab onto anything or make
Right.
anything feel normal. So it's a simple thing. I say just use your hand, and the five fingers represent each of your senses, your taste, your touch, your smell,
Mm-hmm.
hearing, and and what am I leaving out?
Sound.
sound, yeah, hearing. And so just look at your hand and say, okay, I need to pick one thing I can smell. And that can be, say like you have perfume on your arm, just smell that, or just spray something, or what do I smell right now? Okay, I might smell like burgers on somebody's grill or whatever, and then something you can listen to. A song on the radio, focus on the words of that song, or listen to birds singing or chirping, or so, and then go through each of your 5 senses and see, it kind of refocuses you off of what is overwhelming you and gets you centered again. So you can feel like, okay, I can handle this now. Let me start again. Let me get a plan together. Let me try to figure out what my next step is. So it kind of brings you back to the center so you can start again.
And some people use these techniques, like they'll take their shoes and socks off and just stand in the grass and just
There you
feel,
go.
what does that feel like? Or when I have an MRI, I play games all the time. So I count. When they tell me they're about to put the dye in, I always go 1, 2, 3, 4, 4, 3, 2, 1, 1, 2, 3, 4, 4, 3, 2, 1. And so they'll see my fingers moving, like I'm constantly, or I listen to the sounds, and whatever that, I'm like 1, 2, 3, 4, 5, 6, 7, 8. I try to count out that pattern, and then I say,
That's
let's
good.
see if the next set of films is the same amount of numbers as the first set of films. And then, because I'm so consumed with the counting of the sound, that I no longer at all panic that I'm in this little bullet tube. And if I open up my eyes, it's right here, because I'm not claustrophobic, but I mean, it's not like it's a pleasant thing. It's just, you just don't want to look and see the sound
That's right.
right there.
That's right.
So I all the time play these games, or if I get super stressed, I'm a eyebrow rubber. I like to just sit and just do a little rub a couple times. And it's just enough to, because you feel it, and it's just enough for me to say, all right, I need this minute just to feel this, pay attention to this going across. And it just sometimes, so if you guys that are with me, when you see me doing this, just know that I'm a little perturbed. I'm a little off for a second. So yeah, just what I do. And like gum isn't doing it, and other things don't do it, but um I'm a counter. I'm a 2, 4, 6, 8. I go through the whole. I do the odd numbers. They throw me off. I have to start over way too much. But evens are good, and just straighten a line. Yeah, I do it all the time, all the time for all my tests. Like if any test that I know I'm going to be in for a bit, I count. I count my way through it. Otherwise, I usually end up falling asleep through the counting. It's so
Yeah.
distracting to me that I wake up and I'm like, oh crap, I missed that breath hold. I totally missed the breath hold. It happens all the time. So
And
these
those
are all
are
great
things you
techniques.
can, you can learn in therapy. There's also the word pause,
Hmm.
Pause.
Okay.
So you stop, you pause, um, pause, you do an activity, like try to engage in a physical activity, or just you could do like deep breathing or something that can be your, understand that you're in a safe place, or you're going to be okay, or it's not going to last forever.
Right.
And then do something to soothe yourself. That's the S. And that could just be, just kind of rubbing your hands, or like you do with your eyebrow, or they're kind of like those pressure points, but
Right.
just kind of maybe squeezing in here where your hand is to soothe yourself. And then the E of pause is just the exhale, inhale, exhale, inhale. So just kind of like those little acronyms to just try to find what works for you, to try to give you control in the situation.
So important for me. Control.
Control. Yeah.
Big thing.
That's
Big
a lot
thing
of
for
fun.
me. Yeah. Let me check back
Control.
in with
You don't
Josh real
say,
quick.
huh, Karen?
What? Really?
Please and thank you. What about biofeedback? One of my doctors recommended grounding and biofeedback. The only place I have ever felt that grounding works is at the beach. Please and thank you was
Me
on
too.
something.
Oh, that's a nice place.
Me too. Don't ground me in woods. I'm too hyped up looking for the spiders because I know how many are living there. I was just having this conversation today, and I am not. I can't ground me in the woods. Like my best visual that, but it's like a trifecta in the pool, foreground palm tree, background blue waters off of a coast, sound spa gongs, smell chamomile lavender. And I don't even know if I'd be functioning. I'd be so calm and relaxed every time I go on vacation. As soon as I see, and I don't go in the ocean, that's the crazy thing. Just not supposed to be in there. We are land dwellers because they eat what is on the land. I don't want anything nibbling on me, but you look at it and it's like, or if the water rushes up on my feet,
Beautiful.
I am just beyond
Yeah.
connected to. I am absolutely a
And,
water
and I
person.
think using like visualization or
Yeah.
like meditation or any of that, just imagining yourself, and I call it safe place. That's what we call it in
Yes.
EMDR. Just visualizing that perfect place that would make
Mhm.
you feel absolutely safe. And the beaches, I gotta agree with you, Josh.
Yeah.
I love the beach.
When you would say at the end, let's think of like your wasn't affirmations, it was your safe place.
Safe
It was
place.
always riding, and I don't even ride horses, but it was always being on a horse, riding up on the sand of the beach. And the beach is water's always to the right, and all the trees, the palm trees are to the left. I don't know why that was, but and hearing Enya, it's very relaxing music in the background. It was always the same place, and I just immediately felt calm.
And you
Always.
can just go there. Like you can
Right.
think, okay, I got to think about my safe place. And
Yeah.
your mind just goes to that automatically.
Please and thank you. We don't know. Please and thank you. That's this person's handle. And all I know is we are simpatico.
Molly says, Karen, you're so fortunate to have Amy. She's so wonderfully relatable. I agree.
You can find an Amy. Where can they go to find people? Because not all therapists do EMDR. So where can you, what's the best way to find somebody in a town near them?
There is an EMDR website, EMDRIA. It's EMDRIA. And that's the international website. And any of us that do EMDR who belong to that, they have our names listed there by state and by, whether you're in whatever county too. So that's one place to really start with. Another would be as you do research to look for a therapist, a lot of times they'll have it written on their bio that they do EMDR, trauma work, and that sort of thing. But if not, if you call and specifically ask, I'm looking for a trauma therapist that does EMDR. There's more of them now than there was when I first got started with it. But and when I first got started with it, right after I had learned, we got hit with 9/11. So I was all over the place helping with people with trauma with that. But so I kind of got thrown into getting experience right away with that. But since that time, a lot more people have been trained and are using it as a regular tool for treatment. So, but thank you.
Anything else, Josh?
Oh, chat is caught up.
Okay. All right. Well, you know what, Amy? It's number one, it's always so great to see you. Number two, I'll call your office tomorrow. But number three, I always appreciate this so much because it's when we get a chance to talk, it's so much better than just reading this in a guide or a book or a publication because it's just much more human and relatable, as Molly said. I would agree with her. And I love that we ended up our month on such an important topic. I mean, we did all that other medical stuff, and I love that we got to finish our month out talking to you. So I always appreciate the time that you give us.
Thank you so much. Anytime,
It's always wonderful. All right, everybody, do me a
please
favor.
And thank you has another note here.
Oh, okay.
Yes. I'm relating to so many things that you have said. I was driving earlier and couldn't chime into chat. This topic is right on time for me. Therapy was recommended years ago.
Hey, listen, please and thank you. It was recommended to me for a while, before I finally did it. And I am 100% honest that when I first started the EMDR, she knows it. I had a headache one time, I was sick another time. I mean, there was 1 or 2 times that I legit really was sick, but I got very upset, and I started making excuses because it made me nervous. I started feeling fearful because I was feeling a lot of things, and I didn't understand how it was all working and how it was all going to come together, and it felt awkward. And then I finally said, well, nothing that I'm doing right now is clearly working for me. So it can't get any worse. So I'm just going to give myself to this non-invasive treatment. And what's the worst that can happen? I don't feel better. So I was already at the bottom, and I didn't like that. And there's nothing wrong with medication, but I thought that I could do this without that next step, but I knew that was my next step. And I said, you know what? I'm going to go for it. Just like cardiac rehab, I'm going to do the rehab for my emotions and my mental health. And I promise you, please, and thank you. 6 weeks later, I've been a different person for a decade. It's
Yeah.
incredible. And we just hope it stays that way through this next surgery.
It will. It will.
I know
It
it's going to be great. It's going to be fine. It's easy. I
will.
know.
It will.
Okay. All right, everybody, do me a favor. Please click like. Oh, make me feel good. Click subscribe and share this, because this is not just specific to the aortic community. Anybody with health trauma or any other type of trauma really will benefit from learning a lot about all these different techniques and types of therapy that we talked tonight. And again, Amy, thank you so much.
You're welcome. Thank
All right,
you.
everybody, have a good night.
All right. Good night.
Bye-bye.